Hi guys, Dr. Jeff here, the author of Never Look Back, A Simple Guide to the Causes and Care of Back Pain. I'm a 20-year chiropractic veteran. I'm also a non-surgical spinal disc specialist helping tons and tons and tons of patients on a daily basis recover non-surgically from spinal disc injuries such as herniations, disc bulges, as well as degenerative discs. So we specialize in non-surgical cases. My practice is in Shipshewana, Indiana, Northeast Indiana. Also, author of Never Look Back, A Simple Guide to the Cause and Care of Back Pain. My very first book that's coming out at the end of this month, 2022, April 2022. It'll be found on Amazon. It'll also be found on neverlookbackpain.com. Today I want to talk about two types of nerve healing that I see in my practice and how to help the nerves heal naturally. In my practice, what I've observed over 20 years is when we have a disc that's affecting a nerve, there's two types of healing that happens that I have termed centralization and lateralization. What does that mean? Centralization is when we start helping a disc injury patient who has nerve pain down an arm or leg. When all of a sudden, let's say it's at the end of my fingers all the way to my arm, centralization is all of a sudden as they start getting better, they say, you know, it used to be my arm, my hand, and my whole arm. Now it's no longer in my hand, it's just in my arm and my neck. And then after a while, they'll say, it's no longer in my hand and my arm, now it's just in my neck. And then they'll say, it's no longer there, it's just in my neck. And then they'll say, hey, I feel all better. And the same thing with the leg. We call that centralization. Healing from the outside all the way towards the center of the spine. And then the second type of healing is called lateralization. It's just the opposite. So you'll have pain numbness healing down an arm, and all of a sudden the neck will feel better. The shoulder will feel better. The elbow, and then the hand. As soon as we start taking pressure off of a nerve heals a millimeter a day. So it takes a while, but those are the two main types of healing that I see. Centralization and lateralization. So if you have nerve pain and starting to feel different, it's either going to heal from outside to in, what I call centralization, or inside to out, what I call lateralization. I'm going to leave you with 5 things that we typically see in our practice as far as natural supplements that help nerves heal. Now remember, I am not your doctor. I am not dispensing medical advice, so always check with your doctor before taking any supplements. In my practice, this goes for my patients. When I've evaluated you, these are the supplements that we use in my practice for my patients. Again, check with your doctor always. I'm not dispensing medical advice. I'm just commenting on what I see works in my practice with my patients. Vitamin B6 works very well for nerves. Folate works very well for nerves. Vitamin B12, acetyl L-carnitine, and R-lipoic acid. These are the things in my practice that we use with my patients that I've diagnosed and helped. 5 things that they can use to help their nerves heal naturally. This is Dr. Jeff, the non-surgical spinal disc doc, coming to you live, saying I hope you have a great day. I hope you use these very well for your nerve pain. Go out and grab my book. Either get it on Amazon.com or you can get it at neverlookbackpain.com. That website is under construction. It'll be up and running towards middle of May. Dr. Jeff, have a great day.